I've worked with the same anaesthetist, Mark Platt, for all of my professional career. He's a lovely man and a brilliant anaesthetist. We make an excellent team. The thought of having an anaesthetic would make most of us feel very anxious. It's not surprising, really. Surrendering to a process that renders you unconscious and vulnerable is enough to make anybody run for the hills. But it's important to bear in mind that anaesthesia today is safer, more predictable and effective than it's ever been. These days, we mostly use a spinal anaesthetic. A very fine needle is passed into the spinal canal, below the spinal cord. The anaesthetic drugs block the nerves that pass into the lower limbs. This interrupts the flow of information to and from the brain, which means that you can't feel a thing for several hours. Having a spinal is so much better than having a general anaesthetic because you will be breathing without the help of a ventilator. And you won't need powerful drugs to keep you unconscious. Lots of my patients choose to stay awake for their surgery. Mark talks them through the different stages of the operation and keeps them entertained. In my experience, being more involved in the process seems to help patients better to deal with the emotional impact of having an operation. When you go back to the ward, the nurses will give you plenty of painkillers to make sure that you're as comfortable as possible. I hope that this helps to reassure you. Thanks for watching.